Welcome to this Access Anatomy screencast from the University of Leeds that's going to outline the muscles of the anterior abdominal wall and some important neurovascular structures. So on the screen at the moment we can see the sternum and the xiphy sternum. Here's the costal cartilage coming off the 10th rib. Here we can see in the midline the pubic symphysis, the two pubic bones, the pubic crest and the pubic tubercle, the inguinal ligament, and here's the anterior superior iliac spine. If we draw in the midline from the xiphy sternum all the way through the umbilicus to the pubic symphysis, we have the linea alba, and then either side of the linea alba we can draw one of the two strap muscles, which is rectus abdominis. This muscle is passing from the pubic symphysis and the pubic tubercle superiorly towards the costal cartilage and the xiphy sternum. So here we can see rectus abdominis muscle. This muscle is a strap muscle that runs along the anterior abdominal wall. It's got a couple of tendinous intersections here, which splits the muscle into these three muscle bellies, and it gives it its characteristic six-pack appearance when we combine it with rectus abdominis on this left-hand side. So here's rectus abdominis. We won't draw it on this left-hand side, as on this side we'll draw in some important neurovascular structures. So now let's move to the lateral aspect and draw on the various flat muscles that form the more lateral aspect of the anterior abdominal wall. And remember that all three of these give rise to an aponeurosis that goes to surround rectus abdominis in various ways as the rectus sheath. And as these muscles approach rectus abdominis, they become aponeurotic and they form that rectus sheath. And there's another video which details the rectus sheath. So let's start with the deepest of these three muscles, which is transverse abdominis. Transverse abdominis is coming from the posterior aspect from the thoracolumbar fascia, and its fibres run transversely around the anterior abdominal wall. They come from the thoracolumbar fascia, the iliac crest, and also the lateral third of the inguinal ligament. The majority of its fibres, like I said, run transversely across the anterior abdominal wall. But the fibres that are coming from the lateral third of the inguinal ligament actually run downwards. They sweep downwards and attach to the pubic crest. And as also you can see later on, these fibres help to form what's known as the inguinal canal. The inguinal canal is a passageway that allows the spermatic cord or the round ligament of the uterus to leave the abdomen and pass towards the perineum. So here we can see in purple we've got transverse abdominis. The next muscle layer that is superficial to transverse abdominis is going to be internal oblique. And internal oblique's fibres run forwards and upwards. Again, they come from the thoracolumbar fascia, they come from the iliac crest, and they come from the lateral half or the lateral two-thirds of the inguinal ligament. And these fibres, as you can see, are running upwards and forwards. Also, though, these fibres that come from the inguinal ligament actually run downwards and take a similar path as that of transverse abdominis. And we can see here, these fibres are running towards pubic tubercle and the pubic crest. And these two muscles, internal oblique and transverse abdominis, as they approach the pubic crest or the pubic tubercle, combine, they merge to form the conjoint tendon. And we can look at this in more detail when we look at the video on the inguinal canal. But here we can see the fibres of internal oblique are running upwards and forwards. So in green we have internal oblique. The most superficial muscle that we can then draw on next is going to be external oblique. And external oblique's fibres run perpendicular to internal oblique, and they run downwards and forwards. They're coming from the external surface of the 5th to 12th ribs, and on here we can draw the fibres of external oblique. We can see these fibres running downwards and forwards. As the fibres come from the iliac crest, they actually run from the anterior superior iliac spine and they run towards the pubic tubercle. And this free margin of external oblique actually forms the inguinal ligament. So it's coming from the external surface of ribs 5 to 12, And then it's running down and coming from the iliac crest and then the anterior superior iliac spine. It's running down towards the pubic tubercle and the pubic crest, where it forms a thickened free edge, and this is the inguinal ligament. There's a slight defect in the aponeurosis of external oblique, and this defect is known as the superficial inguinal ring. But again, we'll detail that in more detail when we look at the inguinal canal. Here we can see the superficial inguinal ring. So here we can see the three muscle layers that will all give rise to an aponeurosis that surrounds rectus abdominis and forms the rectus sheath. If we now go on to look at the neurovascular bundle, then the neurovascular bundles for the majority of the anterior abdominal wall are continuations of the thoraco-abdominal nerves that are coming down from the thorax as intercostal nerves, and they pass towards the abdomen. So let's start by drawing out the vasculature, and here we have our internal thoracic artery. Internal thoracic artery, remember, runs either side of the sternum. So here's internal thoracic. We have two of them running each side of the sternum and running posterior to the costal cartilages. And as they pass inferior to the costal margin, it bifurcates into its two terminal branches. And here we see we can have the musculophrenic artery, goes to supply the anterior abdominal wall and also the diaphragm. So here's the musculophrenic artery. And the other terminal branch is the superior epigastric. And here we can see the superior epigastric artery. Superior epigastric. So these are our two terminal branches of the internal thoracic. The epigastric, the superior epigastric, is going to pierce the posterior layer of the rectus sheath and supply rectus abdominis. We also have sweeping around from the lateral aspect, and as a continuation of the intercostal arteries that are running down from the costal groove, we have the intercostal artery here from T10, and here we can see another one coming from T11, and here we can see another one coming from T12. So these will be running with a corresponding nerve that we'll draw in a moment. If we've got a superior epigastric artery, we're also going to have an inferior epigastric artery, and here we can draw in the inferior epigastric artery. The inferior epigastric artery coming from the external iliac artery, the external iliac artery running through the pelvis, and here we can see it giving off the inferior epigastric. The external iliac then runs deep to the inguinal ligament and becomes the femoral artery, and the femoral artery gives off a superficial epigastric artery, which we can see here. So here we can see a superficial epigastric artery. Superficial epigastric artery. Here we've got the external iliac, and here we've got the femoral. Inferior epigastric comes from the external iliac before it's passed deep to the inguinal ligament, and here's the femoral artery giving rise to a superficial epigastric. The superficial epigastric is going to supply the superficial aspect of the abdomen, whereas the inferior epigastric is going to supply the rectus abdominis muscle. The final structures we need to draw in are a series of nerves that go to supply the musculature, and these can run alongside the arteries. So here we can see running alongside T10, we have the 10th spinal nerve that's running towards the umbilical region, and then running along T11 we can see the 11th spinal nerve, T11. If you remember, T12 is the subcostal nerve, and that goes to supply a region just above the pubic symphysis. And then we have two nerves coming from L1. We have the iliohypogastric, and we have the ilioinguinal nerve. And these two nerves are both originating from L1. The iliohypogastric runs down and supplies a region above the pubic symphysis and the inguinal region, and the ilioinguinal nerve runs through the inguinal canal and goes down to supply the labia and parts of the scrotum. So here we can see the iliohypogastric Just make it out passing through here, and here's the ilioinguinal. We've got T10, T11 and T12, which is the subcostal nerve, and then we can see various nerves coming to fill the space in between the umbilicus and the xiphisternum. So here we can see we've got T9, T8 and T7. You may get parts of T6 up here as well. So there we can see on the left-hand side the neurovascular structures, and on the right-hand side the muscular structures that form this anterior abdominal wall. These neurovascular structures, coming from the lateral aspect, are going to run in between the layers transverse abdominis and internal oblique.